So good morning. Welcome to the Board of Health meeting for September 8th, 2023. We have kind of a full agenda, just kind of some updates, staffing updates, COVID-19 updates, strategic planning, antivirus, and then wrapping things up. But first we want to announce that we did get Cochise County Health and Social Services got the Breastfeeding Award of Excellent Gold status for 2023. Is Caleb on the call? Can you see that?
I don't think he is.
Okay. Can you see the gold star, or are you just seeing?
I'm seeing your first page
part of the presentation.
Right.
You're just seeing that first title screen, yeah?
Right.
Yeah.
All right, let's try it again. Let's try this one. Now what are you saying?
We see the presentation, but with notes.
Is it in presenter mode now?
No.
Alex?
No, it's not.
Ay. So sorry. Let's try it one more time there.
It's
what it gives me.
With the with the displays.
Okay. Now can you see that?
We see the agenda, yes.
Okay. And it's in presenter mode, correct?
Correct.
Yes.
Okay. I'm going to take that as a yes, but.
Yes.
Yes, it is.
So we did get the Breastfeeding Award of Excellence Gold status for 2023 from the state. Suzanne, do you want to speak a little bit about what that award means?
It partially means that because our numbers were high enough, we were eligible to submit for this award. And in regards to, in addition to the numbers, we provided what type of services we offer, how we kind of overcame the COVID issue coming out of COVID. So we were one of 3 that was selected for this award. We will be receiving a certificate down the road, we were told. We haven't received it yet, but we were kind of excited to get it posted, and so we've, I believe that the PIO was going to post that on our Facebook page as well.
Okay, sorry. We keep getting a dial in, so we're going to try to dial in so that we can hear because it goes in and out on us here.
Okay.
Welcome to the audio.
So some staffing changes or staffing updates. We've been hiring a lot of people and promoting from within. Our new health director, Barb Ling, starts at the end of October. We have a public health nurse in Sierra Vista, Krista Rowledge, public health nurse in Douglas, Karen Miranda, detention health services RN, which is Daniela Greenberg, vaccine equity nurse navigator Eileen Ziebart, which hasn't started yet, but will be starting here soon. Vaccine Equity Program Coordinator, Maida Barara. She was with our prevention service team, but has moved over to the Vaccine Equity Program Coordinator. We've hired 3 environmental health specialists, Giselia Lugo, Axel Lopez, and Pamela Truitt. Health Disparity Program Coordinator of Gentilisa Thibodeau. The Community Health Worker for Health Disparities is Orion Hardy. Health Promotion Manager, Amanda Eckroth, who's been here for a little bit, but I'm not sure that we announced that we had hired her. 2 guardian administrators, Molly McCartney and Amanda Riley, an administrator or a state administrator of Rosa DeFore. Health promote, oh, she's on there twice, so sorry. Women, Infant and Children, or WIC, Sarah K. Ferguson. Most of you guys might know her from being the clerk in Sierra Vista. The Health Start Manager, she was promoted, Letty Apricia, and Health Educator, Mrs. Galvez, I'm not going to even try her first name. And then a new clerk in Sierra Vista, Laura Escobar. So some of our current projects, or bigger projects, I would say, is strategic planning, which we're wrapping up right now. Community health. Community health.
Beth, are you guys the 255-9459 number trying to dial in?
No.
Oh, okay, because that's the one that was giving feedback.
Okay, we had it on Raphael's phone. We have the community health assessment and community health improvement plan that we're currently in progress with LaCroix and Milligan. The One Arizona opioid settlement money that we're working with different parts of the counties, the cities, and the municipalities on how to spend that money. We'll be putting together a mental health summit for November, and we're going to get all the decision makers of all the mental health hospitals, sheriff's office, and schools together to talk about the current status of mental health in Cochise County. And then we've been really working on policies and procedure updates. So the community health assessment and community health improvement plan, we are going to be sending out some postcards to the community through Cochise County, and these are just kind of what they're going to look like. Basically, we're going to let them know that we're going to be sending this survey out. We want to hear from them. One of the first 1,500 respondents are going to receive a $15 gift card. So just so you guys know, this is what it looks like. Be expecting it. You'll scan the QR code or you can call the number and you can take the survey. We're trying to keep the survey down as little as possible, as little questions as we could make it, but I think it's going to end up to be maybe about 40 questions. Danielle, are you on the call? No?
I don't see
So flu and RSV activity within Cochise County, as some of you might have heard, flu and RSV are kind of on the rise, and then also COVID-19 has doubled in the state at least. In Cochise County, we've been seeing an uptick of COVID-19. So here are the numbers from Daniel, thinking that he was going to be on the call today, but
Hey, Beth, I can talk
Yes.
about it a little bit if you want. It's Rachel. Whoops. Okay. 'Cause
Okay, go ahead.
yeah, sorry. Trying to get the slide so I can actually.
go ahead, Rachel.
Yeah. Can you hear me?
Yes, we can.
Okay, cool. Sorry, I'm trying to get it so I can see everything and talk about it.
Okay.
So as far as
You want that one or the next one?
this one's fine. So flu, we're not quite seeing the uptick where the other places are seeing yet, but we are expecting it to pop up, especially after the holiday weekend when everyone gets together at, barbecues and goes to the lake and whatnot. So our numbers are on the low end for what we predict, but we are expecting that to rise because this is the last year of activity. So we're kind of where we expect to be, but in the next couple of weeks, it's probably going to pop up. And then it's kind of the same with RSV, if you want to go to the next slide. So we're actually on the low end of what we expect to see. So you can see about a year ago, we started to see an uptick, and we're not quite seeing that yet, with the caveat that these numbers are about a week out of date, I think. At least last time I talked to Daniel, they were out of date. So, and I don't have them like in front of me, so I'm just interpreting the graph. So we're entering that respiratory virus season. So wash your hands, be prepared.
Okay, so I think that we got the Okay, so can you hear me okay now?
Yes.
Yes.
Okay, perfect.
Thank you, Rachel.
Yes, thank you.
Now you're muted, Beth. We don't hear Rafael's phone.
Now can you hear me?
Yes, but there's a bit of feedback. Let me see if anybody else is.
I want to mute the computer. That's all. Yeah.
Excellent. Man, technology is not my friend.
I think we can
Not
hear
my
you
friend
fine
today.
with-
Okay.
We can hear you fine with your teams.
So we're doing the strategic planning for the county, and we've been working for the last couple of months since Alicia left on creating a new vision, mission, and coming up with some goals of how to move forward with the health department. So we conducted a kickoff meeting with staff to announce the strategic plan process. We recruited a planning team of internal and external stakeholders in all divisions, and we started on the 4 strategic planning team meetings. And I really want to say thank you to Seth, because he showed up for every single meeting, and we really enjoyed his feedbacks and his perspective from the outside view. We used 3 questions on the application process to select the employees from all different divisions at all different levels. And then, again, set the 1 Board of Health member. We conducted 4 in-person strategic planning sessions. We had a structured process with Government Solution, Leadership Solution, or GSL, with critical phases to create the sustainable plan and develop a new mission and vision statement, because we really saw that the mission and vision statements were super long, nobody knew them, and kind of invalid at this point. And then we clarified our core values as a team. So we have the discovery, dream, and design destiny phases. And we did purpose and priorities, environmental analysis, success maps, execution, and evaluation and monitoring process. So here's our new mission and vision. We will work together to promote, protect, and improve the health and quality of life through exceptional public health services and education. And then our vision is going to be, we will promote and support the health and well-being of the public, both now and future generations. And then our values were service, professionalism, open-mindedness, respect, and teamwork. Service being is providing the highest level of results with everything we deliver, both internally and externally. Professionalism is doing what needs to be done to perform our job and support our mission and vision. And then open-mindedness is our willingness to accept new ideas and perspectives. Respect is caring about and demonstrating a high regard for others with our thoughts, feelings, and actions. And then teamwork is working well together and establishing a relationship of trust and to achieve goals. Our top priorities were promote, develop, cultivate, and sustain. And then we took the worksheet goal planning, and this is kind of the stage that we're at now, is our action steps of how we're going to get to our goals and our strategies to do that. And we actually did this step yesterday. We have one more 1-hour meeting that's going to be on Zoom that will really define and break down the strategies. So we haven't finished this part, but we wanted to let everybody know what our key priorities and key goals and strategies are. And then in the next month or so, we will have the strategic plan that we can present to everybody for a review first draft, and then the final plan document, and then get it reviewed and approved for us. Then we go into our implementation plan, which is creating create a communications and rollout plan for staff. We'll conduct regular meetings and update meetings, and then monitor our process with a 6-month consulting, with 6 months of consulting assistance from the government leadership service, and then review and evaluate and change the strategic plan as needed. Because that is a 5-year, the strategic plan is a 5-year plan, and about halfway through the 5 years, we'll look at it, make sure that it is still current and up to date, and if we need to make adjustments there, we will. So why does this matter? Of course, this is going to tell us and lead us and guide us into the future. Does anybody have any questions about our strategic plan or the process that we employed to do that? Okay. Kim?
Good morning, everybody. So we wanted to give you guys a little bit of an overview on the rabies and hantavirus. I know about yearly we give a rabies overview in our CCHA Alliance, which is our Cochise County Health Alliance, but we really wanted to push this out because rabies obviously is an ongoing thing. It's not going away, and hantavirus as well. So we'll just go ahead and start with the view. So next slide, please. So starting with rabies, we just want to make sure that everybody knows that it is a preventable viral disease of mammals. It is often transported through or transmitted through the bite of a rabid animal, and we get cases of rabies reported each year normally, but this year we currently have no rabies reported, which is amazing. And once rabies is the symptoms start, it's 100% fatal. So we want to make sure that everybody is getting the education and it's being thrown out to our community and our healthcare and our first responders. Next slide, please. So this is real touchy. A lot of people don't know what the exposure definition is, but per Arizona Department of Health Services, rabies exposure is broken up into a bite and a non-bite. So a bite is a wound from a tooth that penetrates the skin, and a non-bite is contact with saliva, brain tissue, cerebral spinal fluid into an open wound or in the eyes, nose, mouth, or via a scratch. So the biggest thing I want to say is it can be defined as any bite, scratch, or other incident in which saliva, brain, or spinal cord tissue comes in contact with an open wound, eyes, mouth, or nose. Next slide, please. So what exposures are not? Petting or touching the body or fur of a potential rabid animal, and I cannot stress enough, if you do touch them, you need to make sure that they are deceased. If you do touch them, make sure you are wearing some kind of protective gear on your hands, whether that be a glove or whatever, but we really highly do not want you touching the animal. Either way, call your local law enforcement agency. They will get an animal control officer or a USDA wildlife officer out there, and they can go ahead and pick those animals up and get them tested. Touching an intimate object that has, whoops, I think it just moved. Can you go back to the next slide, Beth? The slide that I was just on. Exposures are not. There we go. So touching an inanimate object that has had been contact with a potentially rabid animal is also not an exposure, but you do, like, if there's water outside, if there is water outside or anything like that, you want to go ahead and empty that bowl and wash those bowls out and disinfect them. Being sprayed by a skunk is also not an exposure. Having contact with blood, urine, or feces. Being in the vicinity of a rabid animal, like if that potential rabid animal is in your backyard, that is not an exposure, but you still need to contact local law enforcement. And touching a desiccated or a dried animal. Next slide, please. I don't see the next slide. Are you guys seeing the next slide? Healthcare providers? No? Okay, there we go.
Oh, it just changed.
There we go. Okay, so we kind of want to push this out there for, healthcare providers, and that would include, our first responders as well, and our communities. So healthcare providers, the rabies post-exposure prophylaxis, or what we call PEP, should be administered after consultation with public health based on the exposure type. So we look at a couple things when it comes to exposure type, and that's going to be, obviously, was it a bite or a non-bite, and stuff like that. And we want to make sure that you guys, a lot of people are aware, and this isn't just for healthcare providers, but a lot of people are unaware of where the rabies vaccine is given. A lot of people are under the assumption that it is given in the stomach. It is not given in the stomach. It is given in the arm for adults and some children, but children can also get that in the thigh. And we start it on day 1, so most likely it's 4 shots, and that would be day 1, day 3, day 7, and day 14. It is required by state law to report the incident to your local law enforcement, and then the local health department gets notified as well, either from the healthcare providers or local law enforcement provides that for us. Below, you'll go ahead and see that link right there that gives you the Arizona Revised Statute 11-1014. And if you want to go to the next slide, it'll show you the ARS statute. I know it's a little bit small, but I just kind of wanted to show you guys what it'll look like if you guys look it up, that ARS statute. If you need that link, you guys can reach out to me, and I can provide a bunch of information on this. Go ahead with the next slide. And right here is the Arizona Department of Health Services algorithms for our healthcare providers. Off to the left, you can see that there's the human exposure to wildlife or an exotic animal. And really, you just follow it. Did the patient report an exposure? Yes. So you're going to find which exposure to which animal, and then you're just going to follow that down. Off to the right, same thing, same concept, but this is human exposure to a domestic animal or livestock. And I did place the Arizona Department of Health Services link down there. I can also send that to you as well. It comes in a full manual, and it is very helpful when you need further information. That can be sent out to you guys as well. Next slide. All right, so what have we been doing for our community? We've been posting this on social media, and this is the rabies flyer that we have been posting on social media. We've also done 2 outreaches, one in Elfrida and one in Sunazona, and it was really nice to talk to the community. Some were unaware. And we did talk to, kids about possibly not touching wild animals and not petting anybody's, dog through a fence and stuff like that. So that was a lot of fun talking to the community. We do plan to do future outreaches with other service areas or divisions here within Cochise County Health and Social Services so that we can get that information out to them. And next slide. So go ahead and concluding on the rabies. The key points here are that all animal bites need to be reported to local law enforcement agency, and then it'll get reported to us as well. We would like a call from you to discuss exposure. We here at the health department do follow up with every animal bite to make sure that the victim is given the correct information and that they have those options for treatment. And we really want to push out to everybody that rabies is preventable, and it is 100% fatal once symptom starts. And of course, we want to make sure everybody knows that as of right now, we have 0 confirmed cases of rabies in any of our population of animals. So that concludes rabies. If you want to go to the next slide, we'll talk about hantavirus. So hantavirus is what we call it HPS, which the hantavirus is the hantavirus pulmonary syndrome. It is severe and sometimes fatal. When I say sometimes fatal, it means it can be fatal. We had there with a mortality rate of 38% in the United States. So it is a respiratory disease in humans that's caused by an infection, obviously, of the hantavirus. It is most commonly spread to people when they have contact with infected rodents, and I want to make sure that we keep that in mind. It's an infected rodent that has the hantavirus, and it is in their urine, feces, and saliva. Next slide. So animals that carry hantavirus. There is certain kinds of mice and rats in North America that can spread it. The biggest one for us here in Arizona is going to be the deer mouse. But I did put the rice rat on the side because we do have travelers. We travel, other people come travel to our states. So we just want to keep in mind that there is other areas of North America that you can get the hantavirus for. If you go to the next slide, we'll show 2 more mice or rats. So we have the cotton rat and the white-footed mouse. And if you can see there on the maps too, it does show portions of Arizona that do have these 2 types of, well, the rat or that mouse. So just kind of keep that in mind. Hantavirus is spread by all 4 of these. Next slide. So how do humans get it? Breathing in contaminated air of fresh mice or rat urine, feces, or nesting material by an infected rodent. Also, you can get it by touching contamination, anything that's contaminated with urine, feces, or nesting material, and then by touching your eyes, nose, or mouth of any individual. So you touch it, and then you touch your child's eye, or stuff like that. It's not just you, like you touch somebody else and you can give that to them as well, but it has to be from an infected rodent. Obviously, from being bitten or scratched by an infected rodent, or eating food that's been contaminated with urine, feces, and saliva. So if mice get into food. Next slide. So symptoms, it can start from 1 to 8 weeks after contact with the infected rodent. So that's why I really wanted to hone in on all those other mice, because that's a pretty big window. So if we have any travelers, then they can travel to our area. If they come up with any of these symptoms, like as you can see in the 4 to 10 days, there's fatigue, nausea, stomach pain. And I know this can be so many different things, but it's just really keep it in mind and be vigilant that, you know, ask them if they've been exposed, if they have been in an infested area and such. But one thing too, I want to hone in is if they have shortness of breath and difficulty of breathing, this is a big one. You know, we got to get them in, we got to get them seen, and really give them the education that they need to call 911 and get into an emergency department. People that usually do not, that have HPS do not have runny nose, sore throat, or any type of rash. So, next slide. So risky activity. So who's at risk for getting this? You know, anybody that's cleaning, anywhere that there's that urine, feces, nesting, they need to be making sure that they're wearing the proper protective gear to clean those areas, and they need to have the education on it. Anybody that's working in the area of where mice, rats live, barns, vehicles that have been abandoned buildings, stuff like that, things that have been closed up for a while, you know, like for the winter, and then they're going in there to do some spring cleaning. That's another risky area. Entering homes, sheds, campers, or cabins infested with rodents. We all know that our first responder community actually enter a lot of these types of homes. And so we need to make sure that we're giving them the right education, and that they're protecting themselves, and that they need to be vigilant. And this could be something that's causing their symptoms and why they're transporting them to hospitals. So we need to pass that information on to our healthcare providers of what they've been living in and such. People that are participating in recreational outdoor activities, camping, hunting, or exploring abandoned buildings or sites, because, you know, that's pretty fun. But, you know, you are putting yourself at risk. So we got to be, make sure that we're telling the community about this as well. Next slide. So for our healthcare providers, our lead epidemiologist, Ginger Dixon, did a hantavirus assessment and management for healthcare providers. This is available to all our healthcare providers. If they do not have it, we could send it out to them. I just wanted to give you guys a little snapshot of it. But as requested, we can get it out to you guys. Next slide. And the same thing goes here for the community education. We went out and posted this on social media platforms, and we went out to the Elfrida and San Azona area, and we plan to go out to other areas to give this information out to our community. Next slide. So key points on the hantavirus is it's very rare, but it does happen. So we just really need to keep that out there. Rodents carry a lot of different diseases that can be passed on. But this is one that hit home for us because we did have one death in 2023 with it. So we want to make sure that we're educating our community and providing awareness to our community, and making sure our healthcare community also has those resources and the knowledge as well, and to remain vigilant. And that concludes the hantavirus. So if any of you guys have any questions, you guys can reach me out in my email. If you would like any of these community flyers, please reach out to me. I'll get that stuff out to you. We just want to make sure that everybody's educated and has that at their hands. Thank you.
Thank you, Kim. So does anybody have any questions, concerns?
About anything?
About anything.
Well, I think we ought to be all concerned that we're getting the information out about the vaccinations that people should have, that flu season is starting, and we need to get the flu information out there. And there's a lot of advertisements about RSV, and people need to know, do they need to have that, at what age, et cetera. So I think one of our big pushes should be education of the public and going online to let people know. Another thing is, especially older people are asking me, should I have another booster shot, for COVID? And I go, I don't know. I'm waiting for information. So I think that's our job as the health department, is to put the information out there. We can't force people to take advantage, but we can always give them the information.
And
This is Lanny.
Yes, Lanny.
A comment and a request. I don't know, I did my column last Sunday on the vaccination and COVID and so forth. I don't know if how many read it, but if not, I can send a copy to Elizabeth and she can send it out to you. It's a column I do for the Herald Review. And also just a request, a lot of times we'll see news releases in the paper about something from the county health, but we haven't had any advance notice. So I was just wondering if it's possible, if you're going to do a press release, that you can also just send us a heads up, because of course I live in Winter Haven and I use a lot of this material for the residents, and I get a question about it or two and I don't have the advanced answer. So just request to be placed on the distribution for press releases. And again, if you'd like to have a copy of the column, why, I'll send one to Elizabeth.
And
that's it.
Can I tag?
Yes, if you could, Lanny, that would be great. And Kim, I know you have your hand up, and Tomini probably could give some information about the COVID booster vaccine.
All right, good morning, everybody. Unfortunately, there is not a lot of information to put out about the COVID booster. As everybody sees, the news reports are saying that the FDA is supposed to approve that today. It should either come today or early next week. Once the FDA approves it, we then wait for CDC to give us approval and standing orders. So currently we are still administering the bivalent throughout Cochise County for those who qualify for it. However, within the next 2 to 3 weeks, I assume there'll be a brand new one out. And then as far as RSV goes, I know that's another big question. And Ann, you had mentioned that RSV vaccines are being given to a different number of populations. At the county health department, we are not carrying it due to the fact that it did not make the order set for the vaccine for children and vaccine for adult program that we're enrolled in with ADHS. We do have a list that the clerks are distributing to people who call and ask about where they can get that vaccine.
Can you make that comment again about the COVID?
I realize that, there isn't solid information right now about the COVID vaccine availability, but I think it's our responsibility when it does become available that we put the information out. That's what I was asking.
Oh, absolutely. As soon as it comes out, we'll notify both in-house and then get our PIO on that information.
Mo, I know you have your hand up also.
I'm sorry, pardon me.
Can you hear me? I don't know how to use Teams very well. So
really quick, sorry. One more thing, if we wanted to cover a little bit more info on the flu or the COVID, I know Dr. McLaughlin is also on the line.
I was just going to ask if you can push out like Facebook posts to us via email that we could all put on our various places that we do that on regarding any of these things, whether it's rabies, hantavirus, vaccines, RSV, the latest COVID, whatever it is. If that's something that's possible for you to do, then we can certainly aid in getting the information to the public.
Yeah, we can provide that for you.
Thank you.
Dr. Eric?
Yeah, hello everybody, and thank you. Yeah, sorry to chime in on this, but you know, the emerging information coming out about both COVID and flu is there's a lot of questions we still have, but I really wanted to stress that, speaking first about the COVID vaccine, we're seeing really good information coming out about efficacy. The new vaccine that we expect to be available, I'm suspicious by the end of the month, has really good efficacy against the current circulating strain that is getting some media attention. You know, we're looking at slightly increase in hospitalization rates, but not the horrible mortality that we saw with previous waves of COVID infections. And fortunately, the new vaccine that we're anticipating has really good efficacy against the current strains, which is pointing all of us towards a lot of comfort that, you know, this is going to be similar to an influenza where we're taking a seasonal vaccine and it's in a yearly type of a booster that will give good protection against severity of disease. Now, you can still get it, and you're going to still likely get a little bit under the weather for a few days to a week or two. But the importance of our vulnerable populations, our elderly, our people with fragile medical states, really getting those vaccines, it's going to keep you out of the morgue and it's going to keep you out of the hospital, which is really a wonderful sense of confidence we're having with those vaccines. Shifting gears just a little bit towards this season's flu vaccine. Actually, this morning, right before I jumped onto this call, I was reading some really good information coming out from the CDC's Morbidity and Mortality Weekly Report that kind of gives us a sneak peek at how good our seasonal influenza vaccines are going to be doing from epidemiological data from the southern hemisphere down. How did South America and Australia and the people on the southern side of the globe do with the same vaccine that we're getting ready to fight with? It's showing about a 50 to 53% reduction in hospitalizations, which is really strong. So some seasons we miss the boat with our flu vaccines. It looks like this season our flu vaccine is going to do very, very well and keep people out of the hospital. Again, it's not going to always prevent you from getting sick or having some minor symptoms, but again, the mitigation of that severity of disease is what we're really concerned with. Is it going to keep you out of the hospital? Is it going to keep you out of the morgue? And we're seeing that the new seasonal influenza vaccine coming up for 23-24 looks very, very strong. So I'm extremely happy to give some bright news while we're all sitting here tapping our feet waiting for those vaccines to come out. So I'm very optimistic about that, and thank you for the chance to speak on it.
Thank you, Dr. McLaughlin. Kim, you have your hand up.
Just off subject from COVID, flu, RSV, I just want to let you guys all know that if you're not aware, there is patient assistant programs for the uninsured and underinsured for rabies vaccines. So if you guys are interested in those, let me know because I can send you those programs. So anybody that is uninsured or underinsured, they work with their practitioner on getting those rabies vaccines.
Thank you, Kim.
This is
anybody
Eric.
else?
One quick.
Oh, go ahead.
I'm sorry, Liz. This is Eric. I just wanted to comment. I'm unsure if people understand the gravity of the cost typically associated with the rabies vaccine series. It's expensive. You know, the series of shots, and Ginger may be closer to this data than I am, but they're about $250 a shot for your series. So you're looking in the neighborhood of about $1,000 to complete a rabies vaccine series, which is eye-watering, especially for a lot of our patients that may not have the financial means to do that or adequate insurance coverage. That's really a great resource you have available out there, and I really encourage all of our clinicians to take advantage of that resource so that we can get those vaccines into our patients who may need them and otherwise may just skip that care. Thank you for that.
Thank you. Anybody else have any questions or comments? Okay. I don't. So that is our presentation for today.
When is the next meeting? So they can be putting it on their calendar.
Alex, do we have the next meeting set?
Yes, it is December 8th. It's a Friday as well.
What,
You
what,
should
what
have
day?
the, what was that, Lonnie?
What date?
8th,
Which month?
December. December
December 8th,
Friday,
okay.
December 8th. Uh-huh. You should have the calendar invite. We will update as we set the agenda. We'll send out reminders and do that.
And we will work on getting a docking station in this conference room at the health department so that we don't have the problem that we're having here currently where you guys are going in and out, but you can hear us fine here at in the room. So anything else for you?
Do we have documentation of who on?
Can everybody go ahead and sign into the chat so we have the documentation for the board members of who was in attendance for us so we can put it in the minutes?
Just hope all of you get rained on.
What do we do?
Supervisor
Just-
English is asking for rain, but on that note, this weekend is supposed to be very hot, so make sure you stay hydrated and make sure you stay in a cool place. And with that, do you want to call the meeting to adjourn or?
Let's adjourn the meeting. It doesn't have to be voted on.
Okay.
I adjourn this meeting and hope to see you in December.